editor, KDK Television, CBS Pittsburgh. And our very special guest is the Secretary of Veterans Affairs, Dennis McDonough. Mr. Secretary, thank you, sir, very much for being with me today. I do appreciate it.
It's great to be with you, John. Thanks for making some time for me.
Well, as you know, Pittsburgh and Western Pennsylvania, indeed the whole tri-state area, is really key for veterans. We've got nearly 250,000 veterans in this 10 or 11 county area. And obviously there are lots of issues of concern, and I want to ask you about some of them in a minute. But first, I know that you want to pitch the American Rescue Plan, specifically as it affects veterans, and I hope veterans in this region. Why should Congress approve this measure when it comes to our veterans?
That's a great question, John, and thanks for the chance to make our case. The bottom line is included in the American Rescue Plan is about $17 billion for the Veterans Affairs Department. And here's why that's important. A big chunk of that, $13.5 billion, is for healthcare. What your vets in Western Pennsylvania and vets across the country are experiencing because of the pandemic is the need to change, delay, postpone appointments. Over the course of the last year, 19 million appointments changed or delayed. That means deferred care. And if we want to make sure that we're investing in the care that our veterans have earned, including care that might be now a little bit more complicated or even more expensive because of the pandemic, we need that extra funding. The second thing is it also allows us to invest in technology. A lot of your veterans in Western Pennsylvania have been pushed onto telehealth platforms. And actually it's working pretty well. A year ago, there was about 4,500 appointments a day. Last month, 45,000 telehealth appointments a day. That means making sure our vets have access to computers or laptops and have access to the internet so they can get online with their doctors. The American Rescue Plan will allow us to do that, and therefore it will allow us to care for our vets at this very delicate time.
Well, let me break that down just a little bit, if I may, Mr. Secretary. Did you just say that the VA will help provide laptops and really portable equipment to allow vets to be able to telehealth?
It has, in fact, it has been doing that, John, and it would be unconscionable for us to not continue to provide that service. That includes both access to hardware, a laptop, for example, or a tablet, and then connectivity from that hardware to the internet, which is not connectivity to the internet, but actually connectivity to the nurses and to the docs in the VA system so that people can get care.
You know, earlier today, I had the opportunity to meet with a number of veterans in the Veterans Breakfast Club here in Western Pennsylvania. And you pointed immediately to one of the issues one of the vets raised, which was the cancellations that occurred during the COVID period and the need now, as they all become vaccinated, to get back into the system. How much of a challenge is that going to be for the VA?
Well, it's going to be a challenge. The good news is that some of the changes of those 19 million appointments were accomplished because of the telehealth platforms and the reforms and the advances we've made. But some of that care was not accounted for. So it's going to be a challenge. We're up to it, just as we're up to this question of vaccinating our vets. We're making good progress on that. It's I think you're hearing good things about, out there, but there's a lot of work yet to do. But let's remember, the vaccinations are just the next step. There's still stuff to do after that, including making sure that we're catching up with this delayed or deferred care.
Let me ask you, if I may, Mr. Secretary, about a couple other issues that came up. One is still the challenge of accepting claims from veterans. Now, some have horror stories where it took decades for their claims to be approved by the VA and to get into the system and through the system. I think some of that is reduced now, but there's still some issues regarding claims. What can you tell us about what the Biden administration intends to do about this?
It's a great question, John, and I know that there's been massive frustration. By the way, the pandemic is creating some additional challenges there. It's basically, we now have a backlog that has resulted from the pandemic of about 210,000 claims. So those are not claims per se, those are veterans. 210,000 veterans who have had to wait too long to get their benefits addressed, adjudicated, and delivered. So the first thing we're going to do is work through that backlog. We're taking some steps now to make sure that we can get personnel into the various agencies to get the required documentation. And the second thing is we're going to dramatically increase training so that the individual claims can get adjudicated much more quickly. We actually made some good progress over the course of the pandemic. We didn't lose productivity as people were teleworking from home. In fact, we increased some productivity. The challenge now is maintain those gains, make up the backlog, and make sure our people are trained to handle these cases quickly so that we do not go back to the bad old days of 32 years to get what a veteran and his or her family has earned.
Well, that's good news if you can make it happen. And certainly a lot of veterans would like to see that happen. There are a couple other quick issues. One is when a veteran leaves military service, if they don't immediately enroll in the VA system, the longer they wait to do that, the harder they find it to get into the system. Is that still a problem? And it certainly sounds like a correctable problem.
It is still a problem. You know, I talked to one vet not long ago. He said that obviously a combat vet has this period of 5 years where she or he can get into the system to get covered right away. But some vets, this fella, in fact, from the Midwest, whom I spoke to, said he really didn't realize he needed the services until 6 or 7 years. And so the real challenge is, and this is something I've spoken with Secretary Austin over at the Defense Department, is making sure that that transition period from when a soldier, a Marine, an airman, a sailor makes a decision to leave the service, that we have a warm transition there where those people are leaving military service and transitioning right into the Veterans Affairs Department. The challenge for us is let's make sure it's attractive to our veterans, that they know the services that we provide so that they're incentivized to come join us. That's a big challenge, and we're working aggressively with the Department of Defense.
Let me ask you about something else that I think makes a lot of Americans sick to their stomach when they hear about homeless veterans and veterans who are out of work and can't find jobs. Having served their country, you would think that this country would have stepped up to the task of making sure that every veteran has a place to live and stay, as well as a job. What is your administration doing to address this? I understand there's some money, I believe, in the American Rescue Plan to address this. Can you elaborate a little bit on that, Mr. Secretary?
Yeah, there is money in the American Rescue Plan. We need that. Now, we've made some progress, John, on this question of homeless vets. In the course of the last 10 years, we've reduced homelessness among veterans 50%. That's good, but that's not good enough, as you said. So you saw in the American Rescue Plan, we're asking for additional assistance from Congress to do things like cooperate with the Department of Housing and Urban Development to get vouchers to ensure that veterans can get into emergency housing. Then we're doing things like ensuring that we're using proven training programs, proven apprenticeship programs, and then proven treatment programs to ensure that vets who need treatment can get it, and then that we can get them into the kind of position, in the kind of jobs that are consistent with their amazing skill and experience and service to this country. We've seen some good success there in some of our VA programming, but we just frankly need to do more. We need to cooperate with states like Pennsylvania, cooperate with the city of Pittsburgh, but also other towns and municipalities in Western Pennsylvania to ensure that we're using all the levels of our governance to support vets in those precarious situations. A big part of this, by the way, John, is our need to get ahead of mental health challenges. Mental health and the results of that, substance use disorder, addiction, are things that we just need to do a better job of addressing. And that's a major priority for us.
A final question, Mr. Secretary. I've talked to a lot of vets who, once they get into the hospital system, they have very high compliments to the staff, the docs, and the others there. And that, by the way, is a change over the last couple of decades that we've seen. So it's a great improvement. But they also say we don't need to go to the hospital for everything. And that's where the VA Choice program that I think has maybe renamed, it's maybe something else now. But the whole notion that, hey, if you want to go to your Med Express or urgent care facility to get treated, or if there's some other facility, rather than go into a VA hospital, those should be important options for you. What's the status of all that? And is there a way to expand that opportunity so that you can get the short-term healthcare you need without burdening the entire VA system?
That's an excellent question, John. There was first the choice program. It was changed by a new law passed by Congress called the Mission Act. So that's the question you were asking a minute ago. And what we're seeing is a lot of vets are getting care in their community, particularly in places in rural communities in Western Pennsylvania, where the distance to a VA facility is just too far. And so that's also the case in other states, obviously, in the country. So what we're seeing is a pretty significant uptake in that, John. And so the challenge for us as the VA is to be a good partner in that program. That is to say, pay our bills on time, providers who take care of vets on behalf of the country, and also making sure that we keep a vibrant network of providers so that when a vet, because of circumstances, needs to go to care in the community, she can really rely on a vibrant network. Now, here's the challenge, which is we have to be careful that as we do this, we're not underinvesting in the VA institution and capability itself. And that's where that integrated care, everything from preventive health to mental health to physical health for our vets is so important. So our challenge here now is to really make sure that these two situations, care in the community and then care in the VA system, are mutually reinforcing and resulting in exactly what we are going to demand here, which is best medical outcomes for our veterans.
Well, Mr. Secretary, thank you so much, sir, for spending time. I should give you any last words to the 250,000 veterans who live out here in southwestern Pennsylvania.
Just God bless you and thank you and your families, your survivors, your caregivers, for everything that you've done for us. Our commitment is to serve you as well as you've served the country. So I look forward to doing just that, John. Thanks for the opportunity.
Well, thank you, sir. Again, always good to be with you. I appreciate it.
I want all hands on deck.
What do you say? Challenge accepted?
I can do this.
Don't be afraid.
5-year-old.